The silent threat in your medicine cabinet, a doctor's warning about everyday painkillers, by Dr. Arvind Das, internal medicine specialist. The illusion of safety. Every day, I see patients who walk into my clinic clutching their lower backs or rubbing their temples, seeking quick relief from everyday pain. Most have already tried something from the pharmacy, and more often than not, that something is a familiar name: ibuprofen, acetaminophen, naproxen, over-the-counter medications used without a second thought. They are trusted, common, cheap, widely available, but that trust, I fear, has bred complacency, and that complacency, tragically, can cost lives. This isn't just another medical advisory. I am not here to scare you unnecessarily, but as a doctor who has witnessed the devastating side effects of misused painkillers, I feel a responsibility, no, an obligation to sound the alarm. The silent threat is real, and it may be lurking in your own home. Let me take you on a journey through facts, real-life cases, medical insights, and a cautionary message that might just save your life or the life of someone you love. Painkillers. The hidden habit. Painkillers are designed to help us. They ease headaches, reduce inflammation, allow us to move despite injury, and help parents get through sleepless nights. But the line between help and harm is thinner than most realize. Consider this. More than 30 billion doses of acetaminophen are consumed each year worldwide. And yet, acetaminophen overdose is one of the leading causes of acute liver failure in developed countries. Think about that for a second. You don't need to be addicted to suffer. Most patients I treat didn't even know they were taking too much. One took multiple cold and flu medications simultaneously, unaware they each contained acetaminophen. Another increased their ibuprofen dose on tough days, thinking it's just over the counter. But just over the counter doesn't mean harmless. Acetaminophen, a silent liver killer. Let me tell you about Mrs. Rao, a 38-year-old school teacher who came to the ER with nausea, vomiting, and confusion. She had been taking acetaminophen for chronic migraines, 1 or 2 pills, several times a day. She had also been drinking a glass or 2 of wine each night to relax. A dangerous combination. Blood tests revealed liver enzymes through the roof. Her liver was failing. We rushed her into intensive care, but within 48 hours, her condition deteriorated. A liver transplant was her only chance. She was lucky. We found a donor just in time. Many aren't so fortunate. What went wrong? The safe daily limit for acetaminophen is general 3,000 to 4,000 mgs. Just 7 to 10,000 milligrams, about 14 to 20 extra strength tablets, can cause acute liver failure in adults. Combine that with alcohol or fasting, and the liver becomes even more vulnerable. Acetaminophen is metabolized in the liver. In normal doses, the body clears it effectively, but in large amounts it overwhelms the liver's detox systems, producing a toxic compound called NAPI, which causes irreversible damage to liver cells. Symptoms of overdose may not appear immediately. In fact, it often takes 24 to 48 hours before liver failure symptoms show, and by then, the damage may be done. Ibuprofen and NSAIDs. The stomach's silent enemy next. Let's talk about NSAIDs, non-steroidal anti-inflammatory drugs, especially ibuprofen and naproxen. They are excellent anti-inflammatory agents, but used improperly, they turn from helpful to harmful very quickly. Case study: Mr. Patel. Mr. Patel was a retired civil engineer, fit and health conscious. He came in with severe abdominal pain and vomiting blood. An endoscopy revealed a massive gastric ulcer that had perforated. Turns out Mr. Patel had been taking ibuprofen for joint pain every day for 6 months. 2 tablets every morning, no food, no antacid, no doctor's advice. NSAIDs work by blocking prostaglandins, chemical messengers that cause pain and inflammation. Unfortunately, prostaglandins also protect the stomach lining, maintain kidney blood flow, and regulate platelet function. When you block these prostaglandins, stomach acid increases, stomach lining weakens, ulcers form, bleeding occurs. In high doses or long-term use, NSAIDs can erode the stomach lining, cause internal bleeding, lead to gastric perforation, result in anemia from chronic blood loss. Worst of all, many of these symptoms are silent until it's too late. Kidney damage, the creeping decline. Let's not forget the kidneys. The kidneys are delicate, highly vascular organs. They rely on stable blood flow and filtration to function. NSAIDs, unfortunately, constrict blood vessels feeding the kidneys, especially in people who are dehydrated elderly, already on medications for high blood pressure, suffering from diabetes. I once treated a young marathon runner, fit, healthy, 29 years old. After a race, he took ibuprofen for sore muscles and collapsed 2 days later with acute kidney injury. His kidneys had been strained by dehydration and intense exertion. The NSAIDs pushed them over the edge. Chronic use of painkillers can also cause analgesic nephropathy, a form of chronic kidney disease that slowly, silently destroys renal function. By the time symptoms like fatigue, swelling, or high blood pressure appear, the damage is often irreversible. Heart risks? The invisible toll. Most people don't associate painkillers with heart attacks, but that's changing. Several large studies have shown that long-term use of NSAIDs, particularly at high doses, can increase the risk of heart attack, stroke, high blood pressure, heart failure. The mechanism? NSAIDs can increase fluid retention, raising blood pressure, affect blood clotting, promote plaque instability in arteries. Even short-term use of high-dose NSAIDs can raise your heart risk within a few days. The FDA has issued black box warnings about this, but how many people read the fine print on a bottle of ibuprofen? The misleading labels. Another major problem is the widespread presence of painkillers in combination medications. Cold and flu products, menstrual relief tablets, sleep aids. Many contain acetaminophen or ibuprofen without making it clear. This creates a deadly trap. A person might take a headache pill, then a flu medication, then a nighttime pain reliever, accidentally ingesting 3 or 4 times the safe dose. And labels don't always help. Dosage instructions vary across brands, countries, and formulations. Many people don't read them or misunderstand them. Children are especially vulnerable. I've seen accidental overdoses in toddlers who got into a medicine cabinet, or parents who miscalculated the dose of syrup. The psychological trap, a false sense of control. Painkillers offer control. They let us work, care for others, function in a busy world. But they can also foster dependency, not always physical addiction, but behavioral reliance. I just can't get through the day without them, a patient once told me. That's when a medicine becomes a crutch, and soon it's being taken not as needed, but by habit. The brain starts associating even minor discomfort with the need for a pill. This can spiral, especially for those dealing with chronic pain, stress, or mental health struggles. The result? Escalating doses, drug interactions, and increasing side effects. A better way. Safe pain management. So, what can we do? 1. Use only as directed. Read every label. Know the maximum daily dose. Stick to it. No exceptions. 2. Avoid combining multiple pain medications. Never mix different products unless advised by a doctor. 3. Talk to a doctor before long-term use. If you're using painkillers for more than a few days, consult a healthcare professional. 4. Eat before taking NSAIDs. Always take with food or antacids to protect your stomach. 5. Avoid alcohol. Alcohol increases the risk of liver damage with acetaminophen and bleeding with NSAIDs. 6. Stay hydrated, especially important when taking NSAIDs to reduce kidney stress. 7. Consider alternatives. Physical therapy, acupuncture, ice/heat, yoga, or prescription medications tailored to your condition may be safer. A final word from the doctor. I want to make one thing clear. I'm not saying painkillers should be banned or feared. When used correctly, they are powerful, effective tools. I prescribe them myself. I take them myself. But I also see the flip side. I see patients arriving too late, families in shock, lives changed forever, all from a medication they assumed was safe. The danger isn't in the drug. It's in the misunderstanding. Painkillers aren't candy. They aren't harmless because they're sold over the counter. They are medicines with powerful effects and serious risks. So the next time you reach for that bottle, pause, ask yourself, do I need this? Am I using it safely? If this article has made even one person ask that question, then I've done my job. Take care of your body, listen to your pain, but don't silence it blindly. Sometimes, pain is the body's whisper before the scream.